There's an endometriosis theme in it, and I feel like it's one of the few books I've read that like really, well, talks about the frustration with the condition actually and the diagnostic process. So if you're someone that like wants support in that way or likes reading stories that are similar to yours, I just want to plug that book because I really liked it.
I remember hearing about this, and I don't think it's you that told me about it.
Welcome to Pelvic POV with your hosts and doctors of physical therapy, Amanda Neary and Hannah Meyer. Hey, Pelvic Freaks. Welcome back to another episode of Pelvic POV.
We're your freaks for us, and we're freaks for your pelvis, baby.
We are well into January at this point, which is my least favorite month. And I know you disagree. I know you hate February more.
Yeah, but it's one I like January because we're talking about setting new goals and being intentional, and hell yeah.
Mm-hmm. The New Year's resolution has had some controversy over the years, and I actually
Yeah, we didn't even read our New Year's resolutions last week.
And we should do them today.
Yeah, we should do them.
But I was looking up what it was that people hated about it, and it just seemed to be like it's unrealistic and people fall off. And then I think the reason I sometimes lean away from them is because they like push capitalism and consumerism, and that's very real. If like companies use them to like sell something that isn't necessary or whatever, like it's January, you need this new thing that'll like change your life. Totally, I get the controversy there. But I personally love setting New Year's resolutions for myself that are like mindset based, spirituality based, goals in general for the new year without like a specific means of getting to them. Like I'm not going to go do a 75 hard, but do I want to like move my body in ways that I enjoy most days a week? Yeah, I think that's like a healthy New Year's resolution. So that's my take on them. How do you feel?
Yeah, I feel like it's different if you're like setting a goal like you said, 75 hard. Mm-hmm. Like a strict goal. My goals are very general. Actually, I have mine, so I'm going to read them if you want to hear them.
Yeah, I want to hear them.
Every January, I make a vision board. I didn't last year because I was depressed, but we don't have to get into that. But this I'm going to make one again this year. Mine for 2025. So this is how I make my vision board, guys, if you want a tip. So this is what I do. I make a list of like my goals or like what I want my 2025 to look like, right? And then I go to Pinterest and I make a Pinterest board titled 2025. And in that Pinterest board, I like pick out pictures associated with the things I wrote down in my notes. And it can be like a ton of goals. It's like what you want your life to look like for 2025. So some of my things, I'm probably going to have a bigger list too once I get more into like actually do my vision board. But so far I have podcast growth and expansion.
Woo!
More involvement in the community.
Yeah.
Thanks.
Sorry. Getting excited.
More time for being creative.
Yeah.
Because I don't make enough time for that. Not lose myself again in a relationship or friendship. Stay hold of my true self. Learn to trust people more, but not be too loyal too quick.
Love that.
Like trust people when they show you that they can be trusted, and then be open to trusting them.
Yeah.
And then perform at a pole show.
Yay!
Those are my big ones.
I'm excited to see. Mm-hmm. I love that.
The Pinterest board, I would take those and pick out pictures that I like. I get a big poster from Target. All right. And then I print the pictures from Pinterest out at Walgreens or CVS. I don't know. Does CVS do that? Walgreens does. And then you cut them up and I Mod Podge them onto that poster board, and I put it up in my like entryway every time I leave my apartment or come in, I see it.
Yeah, I have seen your boards. They're good. I did mine last year in a journal, so I had like a different page for each type of goal. Like I had like love and relationships, career, whatever, creativity, and then I like did the same thing. Like I cut out and Mod Podged my little pictures on it, but each page has its own like thing. And then I wrote on the back of each page, I made a persona for myself. Her name's April. That's my manifestation persona. And what she will be like at the end of 2024. So I wrote like in hindsight, like I'm so grateful this. So I did a little like manifestation on the back of each page. So that's how I did it for last year.
That's really cool. I like how we both do it in a different way, but it's like the same meaning. What would my name be?
You have to come up with it. Your ideal.
Does it have to start with an H?
No. It's literally, you can create any avatar. Think on it.
I know.
What is it?
I like the name Rose.
Rose is cool.
All right.
Nice. Yeah, I like that. So I actually don't have mine prepared for today. Like, I don't know exactly what my goals are yet, so I'm going to leave that out. But I know I will have those kind of categories. Like, I usually have like a career category, love and relationships, communication,
Is
creativity.
there anything that comes off the
fitness.
top of your head? Spitballing? What do you think? Tell the freaks. We can do this in real time.
I definitely, okay. Some things that I'm thinking of in real time are like taking care of myself and having a better work-life balance. Because obviously, like, you know how much the Pelvic Institute has grown this year. And then we started this podcast. And I think the only time I like really mentally stepped away from work was when I was in Greece. And that was like being so far away and in a completely different time zone was like the easiest time I had, and I still struggled with it a little bit. I feel like in thinking about like different opportunities to grow different things, like I was just always consumed by these ideas, and it's all exciting and good, and like I'm busy for the right reasons, but I then like stopped drinking water, like we talked about in our last episode, and didn't cook for myself last year. And I just want to be able to balance those two things and like keep that excitement alive, but then really focus on like taking care of myself too. And I think 2025 will be a much better year for that because it's going to be, I don't know if it'll be more calm, but it'll feel a little more settled in like the way that this company has grown and like what my role will end up being in it. I think I'll get some more like answers in that regard. So that's exciting. So that's one of them. And I would love to just have my like morning and evening routines down, like the ways that I wake up and have like a little mindfulness routine in the morning. And then in the evening, it could be like the way I do my skincare or whatever, instead of like doing it most days, but then randomly skipping it on others. Like I just want to be a little more consistent with those things.
Wow. There you go.
So those are good.
You have some.
Have some.
Hell yeah.
Yeah. We got a couple right off the bat.
Look at it.
Someone sent one in that they wanted
yeah.
us to read.
I had some friends that sent some in too. I asked some of my group chats. I was like, what are your guys' like New Year's resolution?
I have ones from friends too. Okay. This one is from a mom, and she said, I want my hobbies back that I regularly did outside of the title mom: piano, paint, yoga. Aww. And I loved that.
Yeah.
Yeah, just finding yourself again and doing things that you enjoy, finding a balance, I feel like is a common theme.
Outside the title of mom. Mm-hmm. Just like how we were like, we're not just healthcare workers. You're not just a mom.
Yeah, totally.
You are you. Your perspective changes and your focus shifts with kids.
Do you have one you want to read?
Actually, this one's from a new mom. She's currently pregnant. Remember to take care of myself because I can't take care of others if I'm not okay, and to have patience with myself and all the changes to come, especially my body and being postpartum soon.
Love that. These are good ones. Yeah. Another one from a friend was read some educational books in between all the smutty romance books. And you know what? I do read an educational book probably like once every month or 2 months, but do you need to?
It's like, when are they going to kiss?
When are they going to kiss, though? It's crazy.
This is really cool and all, but when are they going to kiss?
When are they going to kiss? When is magic going to shoot out of their fingertips? Like, I don't know. But I respect that. No, I think they're useful. And especially if you're like at a place in your life where like you resonate with those lessons that you're picking up. But
you can learn things from smutty books too.
100%. Go listen to our episode about that.
Okay, here's this one. This is like a lesson that she learned from 2024. Surround yourself with people that make you feel fulfilled and never let anyone disturb your peace.
Oh, love that. Love that.
Good one.
Yeah, I feel like we've been doing a good job of like trying to do that more in 2024. So I'm excited to see where we go with that with 2025. Another one is eat less processed food. And you know what? Girl, same, because I already talked about my Trader Joe's soup dumplings and I'm trying to cook more this year.
We are doing it. This one's funny. Sorry, not funny at first. You'll get it. This one says, release control. Let the universe take care of you. And then there's a second text that said, that's also helped with my bowel movements too if you need a pelvic floor connection.
I love that.
Release control. Let the universe take care of you. So true. Stop straining it out.
That's freaking awesome.
Just breathe. This is a metaphor for both pooping and life. Just breathe and like let the breath take you there.
That's so funny. I love that.
That was my last one that I had.
Yeah, those are some good ones, though. Let us know what yours are. We love hearing from you guys. You can follow us on social media at Pelvic POV and send us a DM.
And that's the episode.
And that's the episode. Goodbye. No, today we want to talk about a topic. We're going to shift gears a little bit. We're going to talk about a pelvic floor condition that we get a lot of questions about. We've talked about in previous episodes. It can be really frustrating. It often leads to like a chronic condition that requires some treatment from multiple healthcare professionals. What is it, Hannah?
Endometriosis.
Endometriosis.
We talked about this on our Q&A episode, and we were saying, yeah, if you guys resonate with this and want to learn more about it, or you've heard this word thrown around and you're like, do I have endometriosis? What is it? Send it in. And a lot of people were like, yes, please teach us about endo. So now here we are.
Now we're going to talk about it from our pelvic floor standpoint. We'll give a little background on what endometriosis is to start. So this condition is basically when uterine-like tissue grows outside the uterus. So that is endometriosis in and of itself, and that can lead to a variety of symptoms, and it can be really difficult to diagnose. So the gold standard for diagnosing this condition is actually through exploratory surgery called laparoscopy or laparoscopic procedure. But without that procedure, it is very difficult to firmly diagnose endometriosis, although there are other methods. So they'll always start with subjective information from the patient, what's been going on, how long it's been going on, when are symptoms worse, all of that jazz. And then the physical exam, so internal pelvic exam, finding pain points. And then there are ultrasounds you can do as well. Mm-hmm. And I think,
like, sometimes ultrasound can show it, but sometimes it doesn't.
Yeah, and they don't go for it as much. Like a lot of practitioners, my biggest qualm with endometriosis diagnosis is that a lot of times based off symptoms, practitioners will prescribe birth control, because it's one of the things that helps with endometriosis symptoms, because symptoms are usually worse on a period. So they say the best way to treat it is to skip your period altogether. I find a lot of problems with that. A lot of people don't have a clear understanding of what's happening to their bodies. And because of that, a lot of people aren't even prescribed an ultrasound to try to diagnose. So like a lot of people that come into pelvic floor therapy don't really know what their next step is. Someone just maybe mentioned the word endometriosis, mentioned an IUD, and they've been dealing with this pelvic pain that they can't really identify. Is that kind of your experience too?
Yeah, 100%. It's always birth control first. And most people are coming in and they're like, I don't want to go on birth control. Is there literally anything else I can do? And then they come and see us.
And I can actually speak from personal experience with this. I went for my annual exam at my gynecologist a few years back, and I was having some pain with sex at that time. And I already had done my pelvic floor training. I told her that. I was like, I'm a pelvic floor PT. I know like what exercises to do. I'm just curious if you're finding anything like internally that like indicates anything else. I was actually more concerned about like PCOS potentially, because I had some other symptoms that made me think maybe I could have PCOS, and I wanted her to explore that. And during the internal exam, she said, I don't really know. Like, you might have endo. Are you on an IUD? And I was like, no, I actually... You know, this was less than 3 years ago, because I was actually getting off birth control for the first time. And I was like, no, I actually don't want to do birth control. And she's like, I mean, that's like the gold standard. So we could try skipping your period and see if it goes away that way. And the way it was like brushed off was like really disheartening to me, where I was like, I don't think I have endo. Like, this isn't a long-term issue that I'm having. Maybe I do, but there's not like a great way of knowing if all you're offering me is birth control.
You're like, let's just skip your period and see what happens.
Aside from that, I didn't want to be on birth control. Like, I've had bad side effects from birth control for years. There were reasons why I went off of it, and I feel like that point was completely dismissed, and it was still just like, nope, you should be on birth control. That's the gold standard. So it can be really frustrating. Even if you're like, I don't know what's going on, and someone mentions it to you, it's a frustrating experience. So as women, sometimes we can relate to that. But as pelvic floor PTs, what we're seeing when people come in is a lot of pelvic pain with intimacy, pelvic pain and cramping on their period. So some misconceptions are that period cramps are really severe and painful throughout your entire cycle. I don't know about you, but in high school, I was told that that's totally normal to like have really painful periods, these cramps that just linger. Everyone's normal is a little bit different, but if they're severe and you're like staying home from school, vomiting, staying home from work as an adult, that's not normal. And we should really take that into consideration more as healthcare professionals.
100%.
Yeah.
I'm one of those people that birth control actually worked for when I had my really bad period cramps, which is kind of annoying because I'm like, birth control doesn't work. So sometimes it does, which is why I understand why doctors will lead that way.
Also, birth control is an amazing medicine and it should be an option. Like, absolutely for birth control is an option for everyone. We really need to educate patients on like side effects and what birth control actually does to the body, because we're giving these like 16, 17, 18-year-old girls and women birth control and they don't know a lot about it. Like,
have you guys seen that the packet that comes in your birth control pack? You can literally expand that and then wear it as a blanket. Like, I'm not kidding. It's as big as, like, if you unfold it, it comes in your little birth control pill thing and you literally can expand it like a blanket.
That's how many side effects there are.
It's like when you go over to your friend's house and they don't have a blanket and you're sleeping on the floor and you're cold, you can just open your birth control packet and use that as a blanket.
Yeah.
Use the list of side effects as a blanket on the floor to paint a picture for you. Crazy.
And
I
it's
shouldn't
just
be laughing, but like that's, yeah.
It's ultimately just a testament to how little we study women's bodies and how medicine affects women and in healthcare, because this is a medicine that unfortunately is only prescribed for women right now, or people with female anatomy that can carry a fetus that are at risk of being impregnated. So yeah, I think we just need to be better about that.
Another thing about endo is that it can grow like all over the body. It can be in the lungs. It can be literally anywhere.
Yeah. And it gets brushed off a lot like, oh, it's just endo. Like, so many people have that. Here, take birth control. And we're just not studying it for what reason? I don't know. So that's like my medical issue with endo. Also, in making my little outline, I saw in my search that there's a misconception that pregnancy cures endometriosis. Have you heard that?
Never.
I've never heard that in my life. So I was curious if you knew anything about that.
I have like patients that have like 3 kids and they still have it.
Yeah.
So I don't know.
I mean, I know it's not real.
Yeah.
I just didn't know if you had heard that myth from someone.
Yeah, no, I don't think so.
Yeah. And that's the other thing. Endometriosis at an advanced stage can affect fertility and your childbearing ability. So this isn't something to be taken lightly, like, oh, just skip your period and it's fine. Anyway, we'll dive into the pelvic floor side of it now. We're going to get on this like medical gaslighting rant and never get off of that. But Hannah, can you talk about a little bit what you're looking for when people come in to pelvic floor therapy with either a diagnosis of endometriosis or just symptoms that are consistent with that diagnosis?
Well, sometimes I'll see patients that have already received a diagnosis from their doctor, but it's not the surgical diagnosis, the standard, you actually have endo, it's suspected. And they're like, my doctor told me to go on birth control. I don't want to. That's one type of person that I'll see. And then sometimes I'll see people after endometriosis surgery. And so there's 2 routes we can go here because I get questions for both. So let's say like you don't know if you have endo or not, but your doctor like threw it out there. And then maybe you had an awesome OB and she told you to go to pelvic floor PT, which that doesn't always happen. So yay, welcome to pelvic floor PT. Let us take care of you. So we collect your subjective histories and we listen to your symptoms. And I'm specifically looking to see like if your symptoms are worse on your period or when you're ovulating. That's like a big trigger for me for like endometriosis. And treatment wise, like I'll literally have an exercise routine. I'm like, this is what you're going to do, like prepping for the week of your period. These are your exercises that you're going to do daily, prepping for your period, for example, almost like prevention strategies to help manage symptoms throughout. But specifically when patients are coming in, we'll do an internal assessment and we'll look for like painful trigger points internally. Just like we do with any other patient that doesn't have a diagnosis of endometriosis. Yeah. I also focus heavily on abdominal work with endometriosis. So I'll assess tension in the abdomen. Usually there's a lot of tension in the abdomen. Like I'm telling you, like if I'm trying to like move your fascia on your abdomen, it's like very stuck and sticky. So we'll do a lot of like myofascial release on the abdomen, maybe some cupping, maybe some dry needling, some like skin rolling on the abdomen or like that. But that's typically another thing that I'll see.
I mean, you pretty much nailed what we're like looking for treatment. When I treat these patients, I often try to line up a session or two, either like the day before their cycle is supposed to start, or if they have a really regular period, coming in on their period.
Coming in on your period.
Yeah.
For sure.
A lot of those trigger points or really painful spots that people will feel with endometriosis, we can find the referral source from that internally with a finger release on that trigger point. And they tend to be highlighted during the cycle. So I've had experiences with people who have been diagnosed with endo where like in the luteal phase, like we might not be finding as much, but then once their period starts, we're finding it and they're like, that's my pain. Mm-hmm. That's the pain that I have to take medication for.
Or it can be disheartening because patients will be like, oh, my pain is better. Oh, now it's back. Oh, it's better. And they don't correlate that it could be with their cycle or like with their period or even with ovulation.
Totally.
Too, because sometimes they'll be like, why am I having my pain? I'm not on my period. Well, what part of your cycle are you on right now? If I have someone that's coming in that's like suspecting endo, I tell them to track their period and track your symptoms. Track your symptoms with your period.
And then it's another unique experience when someone is on birth control that either lightens their flow or stops their period altogether. Some birth controls you still ovulate on and some you don't. So especially with these IUDs that are often being prescribed for endometriosis, when people have a lighter flow or no period at all, but it maybe is around that time that they're getting symptoms, eventually we start to correlate and they're like, you know what, I think this is when my cycle would have been. But they never would have thought about it that way if we weren't working internally and finding those points. Mm-hmm. So because everyone's coming in with a different diagnosis, different medication that they're on, if any, different treatment path that they're on, we kind of tailor our treatment based on that.
Mm-hmm. Based on what we see in your symptoms present in this moment.
And sometimes we'll completely reduce pain 1 month. And like you said, like it'll get better and then it'll come back. So because this is often a chronic pain issue, it doesn't change overnight and it tends to take more sessions with these patients than with others to really get that pain down. But good news is we can make a big difference.
Something I will say too is that people with endometriosis, I feel like too intensive exercise can really flare pain symptoms.
Like specifically during the cycle or at all?
Like at all. When you're in like that much of chronic pain, like exercise can like really like flare them up. That's like commonly what I'll see with like my patient population. Mm-hmm. So yeah, like HIIT training could be intense. Like I actually remember when I was like a personal trainer and I would have like people with endometriosis and I would like give them the same workout regime that I would for like that I would for someone that didn't have endometriosis. And it was like it was not aligned at all. And this is actually one of the things that prompted me to go into pelvic floor specialty was like, okay, this client with endometriosis, I don't get it. Like, I don't get why, like, I can't have them do this same workout routine that I would for like someone else. Mm-hmm. And or like why their symptoms are flaring so bad or why they need so many more breaks. And like I said, this could be like client specific. This is just my experience. I don't think like HIIT is a great workout for people with endometriosis.
I think this is a good way to talk about why we find that like Pilates and slower movements work for so many of our patients as pelvic floor therapists, because we're often seeing people with pelvic pain. So we see a larger endometriosis population than you would at a gym, right? Like you'll get your clients and then you have your sample size from that. But for so many people with pelvic pain, these slower movements and exercises that really focus on stability and deeper strength at a slower pace, not necessarily like lifting weight fast in a HIIT training capacity, will work really well for these patients. Mm-hmm. And I think that makes sense.
Yeah. Yeah. We really like I like Pilates because it focuses so much on alignment too. Mm-hmm. I think it can be really helpful to like get back into your movement groove if like you have endometriosis and you feel discouraged with exercise.
And mobility too. Pilates is like traditional mat work, focuses on moving the spine through all of its shapes and angles. And I love that. You're not like stiff in one area. You're getting really mobile. And it helps with like flexibility, mobility, just feeling good. And then you also get stronger.
Yoga's great too. I
love all of it. You know what we love to do.
You know what we love. Okay. And then I mentioned people coming after surgery.
Let's talk about surgery in general. Another aspect of endometriosis that we didn't touch on yet is that sometimes surgery is something that is recommended for them. And a lot of patients come to us wondering, whether they should do surgery or not. And the research on it is so mixed. And are you finding that with your patients too? Mm-hmm. And surgeries can vary. Like certain procedures will just work to remove some of the external uterine tissue or the fibrotic tissue that's forming outside the uterus. And mixed results every single time. So like I have patients who get this procedure done. Maybe they've had pain for years and just have been really frustrated with it. And it's kind of like a last ditch effort to see if it helps. Sometimes it does. And sometimes there's absolutely no change. So that's why the research is so mixed on it. It's basically like 50-50 at this point. And then in really severe cases like stage 4 endometriosis, people will have either like a fallopian tube and ovary removed that the tissue has wrapped around, or sometimes there's a full hysterectomy that's performed in these cases too. And again, we're getting mixed results from those. So we do see people questioning whether surgery is right for them. And we see people post-operatively, which I think you wanted to talk about.
Yeah, I see people post-operatively and then they're frustrated that they still have pain. Yeah, you can still have pain post-operatively. I mean, at the end of the day, you just went through a huge freaking surgery, abdominal surgery. Any surgery is going to be intense, especially with endo when it's so new. I mean, like the endometriosis itself isn't new, but like the way people are treating it and figuring out something new every day about it.
And the fact that like we're going into these procedures not knowing exactly what is causing the pain. So we're not going to know if removing certain tissue is going to help with the pain. Like even if it is in the area that you're experiencing it, we know that the pelvic floor has a lot of these trigger points and referral patterns to different areas of the body. So was that pain coming from fibrotic tissue or was it coming from a trigger point in the pelvic floor? Like there are different things that could be going on that cause that. And it's a really frustrating experience to come out of surgery and still have your original symptom there. So we're often, educating on pain science because pain is multifaceted in any capacity, especially if it becomes chronic. It could be that the original trigger of that pain has been removed and your body's still experiencing it. Like similar to phantom limb surgeries or experiences with amputations and things like that. Like that's kind of how we understand pain theory. And so oftentimes we're treating this chronic pain or this almost memory of pain too.
Yeah.
So there's a lot of different ways to like approach it, look at it, educate. And then if you're seeing someone post-operatively, we're working on scar tissue as well.
Sometimes they don't remove all the endometriosis. They don't remove it all.
Yeah.
They can't remove it all depending on like where it is, and et cetera.
Yeah, it could just be lingering. And then you have mobility restrictions from these tiny incisions, but incisions nonetheless, like an incision on the abdominal wall. The most I learned about this was from my dry needling courses, but how much that little incision can pull on other areas of the body and tissue in other areas and cause pulling and mobility restrictions was really fascinating to me. So now I do a lot of needling and soft tissue mobilization on scar tissue as well.
Me too. I'd love to do that.
I know.
It's like fascial needling on the abdomen, even if they're like it's a tiny laparoscopic incision, right? So it's like maybe like the size of a dime.
It's important to note that for those small incisions, we can make a difference years later as well. So it doesn't have to be right after your surgery that you went in for that kind of work. With that scar tissue, it can be really beneficial to get that checked out, even if it was years ago and you're like, maybe that is what's been pulling on my back or whatever area. It's worth it to get it looked at. So some other things we'll ask about and look for in our assessments are whether a patient is having pain with intimacy, with any sex, or any even foreplay, external work, penetration, anything like that. There can also be pain with like bowel movements and urinating. So
you can have urinary symptoms as well, like stress incontinence, urge incontinence, and things like that. If you have a more hypertonic pelvic floor or more trigger points in your pelvic floor muscles, increased soft tissue restrictions, then it can impact your urinary symptoms.
Yeah. And we approach what we see, or we treat what we see. So if any of this is coming from tension, which oftentimes it is, we're going to try to reduce some of that tension in the pelvic floor and lengthen those muscles and work on a lot of breath work, things that release muscles, just give you a little routine for when your symptoms are worst. So if during intimacy or during your period, we'll have the pre-sex routine or the first day of your cycle routine. And it's often whatever exercises are manageable at a painful time, which in my case is often like breathing exercises and maybe just some positioning. We often like have tools that we can give you as well to kind of co-treat that.
If you are diagnosed with endometriosis from your doctor or think you may have endometriosis, see a pelvic floor PT, please, because you're probably frustrated with the fact that you have no idea what to do. And that you're probably frustrated with the fact that you don't want to go on birth control, or that's the only suggestion, or maybe it's not working for you. And then also you're frustrated with the fact that there's not much research on it. You're probably in like a group, a Facebook group or something of other people that have endometriosis that are struggling with the same thing. If you see a pelvic floor PT, will help you get back to like doing the things you want to do and treating your symptoms. So that's a big plus. 2, we're going to advocate for you and help you, even if like PT isn't getting you 100% of the way there. We see this all the time. So we have great referral resources, whether it's pelvic pain specialists, whether it's injections, or like we'll have options for things that you can try to help to get you to feeling back to that 100% or as best to our ability as we can. And yeah,
absolutely.
There's more. There's just see a pelvic floor. I promise you, if you are frustrated with like the healthcare system, like seeing a physical therapist, you're going to have so much more time to like really talk and understand what your diagnosis is and how to manage it versus like a 10-minute doctor's appointment.
Yeah. I think that is our benefit, is that we get to spend so much time with our patients. So there's time to educate, there's time to answer any questions, talk through these things. My unofficial advice, this is not medical advice. My opinion is that if someone mentions surgery, but they have not mentioned pelvic floor therapy, and you're like, what? I'm like on the fence. I was told I should get surgery for this, whatnot. Go see a pelvic floor therapist first. In any case, most surgeries have a protocol now that they're managed conservatively before they do an invasive procedure. Like in any orthopedic condition, knee replacement. It's like, go try PT first, and then if it doesn't work, we'll give you a knee replacement. That doesn't seem to be a thing that's standardized for endometriosis yet, but that is my advice to you. If you're given that option, but you've not been told to go to a physical therapist, please try it first, because it might not be necessary and it's worth a shot.
And then you'll have your PT too that you can also talk to and be like, okay, now my doctor is telling me I have surgery, been doing PT this whole time. I feel like I'm like 60% better, but I still have that 40%. Do we think I should go through with surgery? And we can talk through like what post-surgery will look like and like the options so that you don't feel like you just have to go to surgery if you don't want to. Or maybe we can say like, yeah, maybe it is a good option. I don't know.
Yeah.
We're not going to like influence your opinion, but we'll help you through it.
Yeah.
Like we have long 1-hour sessions, baby, that we can chat it up.
Yeah. We can offer support. And then just some things I've heard from patients that have been really helpful are Facebook support groups, because there are other people that have this condition that are also frustrated with the healthcare system. And they've found that like that's their best resource. I think it's worthy of noting that people find comfort using those groups as well.
And that goes for like any that PCOS, endo, anything like that, any kind of diagnosis.
And then another one that I found interesting was the book Conversations with Friends by Sally Rooney. Trigger warning, but cool stuff. But there is an endometriosis theme in it. And I feel like it's one of the few books I've read that like really, talks about the frustration with the condition actually and the diagnostic process. So if you're someone that like wants support in that way or likes reading stories that are similar to yours, I just want to plug that book because I really liked it.
I remember hearing about this, and I don't think it's you that told me about it.
Yeah.
So
it's a good book. I loved it.
I like that. And it's a fiction book, right?
Fiction. Yeah,
That's
baby.
cool.
Have you read any Sally Rooney? She's very like dry and dark. So there are trigger warnings in her books as well. Make sure you read the back. But she's an Irish author, and most of her books take place in Ireland or the UK. And I just love her writing. Like it's very blunt in a really cool way. It almost feels like you're reading a journal. I loved it. Anyway, I like her style. Reading some Sally Rooney.
Heck yeah.
Yeah.
And there are multiple things you can do for endo. Like we can try so many things. We have like, remember we had our Reiki episode, right? We have our acupuncture episode, our herbalist episode. Like we can, if you're going to your doctor's like birth control and surgery, and you're like, go to your PT and maybe we can give you some other options too. And we can do collaboration of care to get you better.
Totally.
It's all about the collaboratory efforts, which is lacking in the healthcare industry. Like we preach collaboration in PT school, And then you get into the real world, and then it's like takes a month to try to speak to an OB, and you have to buy them lunch in order to talk to them. But that's on me on my soapbox.
It's one of the reasons we end up collaborating so much more with like sex therapists, other like outpatient rehab kind of specialists, because it's really hard to get through to some of these larger like hospital systems or places where they have these practices in place where you have to plan this thing a month out to really collaborate. So
it's usually by like word of mouth. Like we'll have patients refer or like go see their OBs or their like colorectal surgeon, I don't know, urogyne, whatever. And they'll tell them about like, oh, I'm doing pelvic freaks to this, and this is really helping. And that's like the most that we can get sometimes. But maybe 2025, we can try to reach out to more physicians and like boost that again.
Yeah, it's an ongoing effort for sure. But we collaborate with some amazing practitioners already. So if you're coming in for something like chronic pain or endometriosis, we have so many resources available that we utilize in our treatment as well.
I think a goal for 25 for me for the podcast is to have like a physician, a pelvic pain specialist on here that we can chat it up with, get some physician takeaways and point of views, and to talk about like their qualms with healthcare.
Yeah.
And like how, because I'm sure like from our perspective, looking at like a physician, we're like, they don't have time to see us. But like from their perspective, they're like, well, I have 60 patients to treat in one day. And
they're incentivized in different ways. And it's not
so.
No, it's not a personal choice. It's usually just a result of who they work for or where.
Yeah. I mean, I get it. Like at my last job, like I had like 16 patients in one day. Am I going to give you, do I have time to sit down for an hour and talk to you about like what endometriosis means to you? No, because I have a knee patient around the corner doing some long arc quads.
Totally.
You know?
Doing some long arc quads. Not the plug. I love it. No, it's real. It's true though. That's a good idea. We should get some other healthcare professionals on here and some physicians.
Yeah, I think that's it. And I think that's like kind of I mean, guys, if you guys have questions, we'll go in.
We'll go in. Endo is such a big topic. This is probably not going to be a one episode series on endometriosis. It's something that will come up time and time again. So if you have questions based on anything we said today, please submit them at the link in our bio. Again, our social media account is Pelvic POV. You can submit anonymous questions in our bio, or you can DM us, and we always save those for future episodes too.
Lovely.
All right, guys. We hope you make some good New Year's resolutions for yourself after this episode if you haven't already.
Do your vision boards.
Do your vision boards. We want to see them. Send us your vision boards.
Send us pictures of your vision boards.
Yeah.
Please.
We'll post ours.
Yeah, I'll post my vision board for you guys too.
All right. Bye, Pelvic Freaks.
Bye, Pelvic Freaks.